Welcome back to Rural Health Today. This episode is another installment in our season on maternal care and rural health, where we're talking with maternal health experts about rural maternal morbidity, genetics, mental health, and more to understand the barriers to proper maternal health care in rural America. Hello, I'm excited to introduce our guest for the second episode of our Maternal Care in Rural Health series, Adrienne Griffen, the Executive Director of the Maternal Mental Health Leadership Alliance. And I am so excited about this and so passionate about this particular topic, notwithstanding the fact that my wife is an OB nurse for over 2 decades, but also something that I, as a leader of this hospital, have been able to lead in this initiative to provide services for those who need it the most. In a community that has nearly 75% of our OB population Medicaid, a population that certainly is in need of services in our community. And we simply parallel what we find across the country. In rural America, we have, the disproportionate share of Medicaid patients, those patients who are poor and otherwise unavailable for access to services at times. And in many cases, we hospital leaders have to bring those services to our community. And in many times when we can't do that, we partner. And our partnerships involve finding strategic leaders, such as we're going to talk with today, to say that there is help out there for those. And so, Adrienne, tell us about the Alliance, your role, maybe how long you've been in your role, and what brought you to your organization.
Oh, great. Well, thank you so much for that warm welcome. I'm delighted to be here today. So I'll start by just talking about why I do this work in supporting the mental health of our mothers. I call myself an accidental advocate because if you had told me in my life BC, that's my life before children, that I would be working in women's mental health, I would have laughed at you because it never even occurred to me. I knew nothing about mental health. I was in the military. I graduated from the Naval Academy. I was an intelligence officer in the Navy, right? I worked at the Pentagon. I worked at the White House. I worked for the United Nations. I was going to run the world. And then I had a baby. And it really took me to my knees. I had never experienced a mental health condition before, but I had significant postpartum depression and anxiety. And it took me about 6 months to get the help that I needed, despite having every advantage, right? I live right outside Washington, D.C. I have a husband. I have insurance. I speak English. I had the internet. I had all of those things. And it was really, really challenging to find the help that I needed. It was navigating this whole mental health, behavioral health system that I knew nothing about while I was in the pit of anxiety or depression. And it was during that dark time in my life. And I was like, why is this so hard? I have got to do something about this. And so once my children, were grown and went off to school, and I had the opportunity to sort of make a pivot in my career. And so I started leading support groups at a local hospital for moms who had postpartum depression. And then I volunteered with a national organization, and then it just kept getting bigger and bigger. I started a nonprofit in Virginia where I live and ran that for 10 years, and then came to the national organization about 5 years ago. There had been an effort to pass a piece of federal legislation to support maternal mental health. And the woman who led that effort came to me and she's like, we got to start a nonprofit. We got to start an organization to keep the pedal on the metal at the national level. And so, I've been leading Maternal Mental Health Leadership Alliance since we launched in 2019. And really thrilled to talk about our work today and about maternal mental health, why it's important, what we're doing to help new moms, and how everybody can be an advocate for maternal mental health.
What an incredible story that you have, born from your own challenges, frustrations, certainly a very strong, independent woman, I can tell, having led, probably a series of soldiers and certainly, traveling across the country. But in the midst of that, you find yourself in a moment of despair that many women in this particular situation, post-birth, find themselves in, and even pre. And the feeling of emptiness and aloneness sometimes can be extremely overwhelming and oftentimes misdiagnosed, scoffed at in particular certain times in our lives and society, scoffed at. But raising awareness and bringing the attention to our communities throughout this country is really what the intent is today. You share your story, but then you also took action. It wasn't just, I got myself over it. It was, how do I empower others to get through it? And I really want that to be a focus of something that we talk about today, and we will in just a minute. But before we get into, the how and the why and some of that, can you share with us, for our listeners across the country who have no idea who you are, do you have a fun fact? I mean, first of all, the fact that you worked for the Pentagon is pretty awesome. But beyond that, is there any fun fact or an item that, would help our listeners get to know you as a person? Like, oh my goodness, she is real.
Oh, yes. So a fun fact is that I love to tap dance.
Wow.
Yeah.
Wow.
When I was a kid, my mother ran a very small dance studio in the little town that we grew up in. And so I started tap dancing in like 6th grade and continued through high school. And then, when I was an adult, and it's so much fun to make noise with your feet. And it is so, like if I was stressed and worried about something, it just sort of evaporated because all of my thought was going into my feet.
Yeah.
And
Isn't that amazing?
Yeah.
That's awesome. Yeah. Well, it's a great, that is a great trait and obviously skill to have, something that I'm sure has served you well as you've been frustrated many times, probably dealing with issues that we're going to talk about today. And that's how to raise awareness in communities and individually to empower individuals to advocate for themselves. And it's really a little bit of the focus of what we want to talk about today. And we're going to, tap our way right into this one, okay? Because at the end of the day, we're really talking about the maternal mental health aspect. And although this topic has been gaining attention, I would say, and correct me if I'm not wrong, probably over the last 4 to 5 years, seems to be gaining a little bit more traction than it had before here in America. Many moms across this country do not receive the help for their mental health during pregnancy and during that postpartum period. They just don't get it. Maybe it's lack of access in rural communities where it doesn't exist. Maybe it's unwilling to go. Maybe it's feelings of, I can't do this because that then shows that I'm not strong. Whatever it may be, whatever the self-guilt is, whatever it is, they are not receiving that care which they so desperately need. So I'm going to ask you, you're here to share your perspective and insight. I want to start with, especially as it relates to the field of healthcare that we're in the fact that we see this every day. We deliver hundreds of births a year, hundreds and hundreds. We have an opportunity to work with a population, high Medicaid, as I said. We find that to be in the disproportionate rural communities, very significant, resources lacking. And so there is oftentimes a lack of awareness that what resources are available. And I want to, by the end of this podcast today, really give the information to our listeners about what is available. But let's start with the needs first. Let's just start there. So I guess I'm going to ask you, where do you see the gaps in mental health care, and what are the barriers you've seen that are connected to these gaps?
Yeah. So let's just first start by getting at some facts and figures about maternal mental health. So we know that mental health conditions are the most common complication of pregnancy and childbirth. They impact at least 1 in 5 women either during pregnancy or their first year following pregnancy. So the most common complication, right? And we know from states' data that mental health conditions are the leading cause of maternal deaths.
Yeah.
So every time I say that, it's almost like a punch in the stomach.
It
okay,
is.
So you're telling me that the most common complication of becoming a mom is a mental health condition, and that the leading cause of pregnancy-related deaths is suicide and overdose. So that's very, very sobering.
It is very sobering.
Very sobering. And there's lots of women who have a joyful experience during pregnancy and postpartum. I did with my first child. She was a super easy baby. I loved being at home, all of that. And my husband and I are like, oh, we're such good parents. Let's go ahead and have a second one. And it was a completely different circumstance. That's the baby that I had postpartum depression with.
Right.
Right. And so, we often don't talk about these things because we don't want to scare parents, right? We don't want to scare moms. We don't want to scare their partners. We know that 1 in 10 dads will also experience postpartum depression. So we need to be talking about this. Just the way that we would talk about any other aspect of pregnancy and postpartum. So here's a few other quick statistics. So although this is the most common complication of pregnancy and childbirth, only about 20% of doctors, of obstetricians and pediatricians actually screen their patients for these, for these illnesses. And partly why they don't screen, and we've talked with hundreds of them, we are basically, they keep telling us 4 things. Number 1, we don't have any training or education in this. Number 2, we don't have any resources.
Right.
Number 3, we don't get reimbursed. Right. And number 4, the screening tools that we have are inadequate. They're out of date, all of that. So I totally get it. If I didn't know what I was talking about and didn't know where to send people for help and didn't get paid to do it, I wouldn't want to talk about it either.
Sure.
So we've launched, huge efforts over the last several years to make sure that frontline providers, obstetricians, pediatricians, primary care providers, anybody who's working with pregnant and postpartum parents are aware about these illnesses, know how to talk about them, and most importantly, know how to connect their patients with help. And so I'd love to talk about those opportunities to connect people with help.
Well, we're definitely going to do that here in just a moment.
Awesome. Sure.
One of the things that Hillsdale Hospital is engaged in is centering pregnancy, and a great program that connects resources on, when you look at social determinants of health, making sure that moms have the nutrition that they need, right? Is equally important as making sure that moms have the mental health services that they need.
Absolutely.
And placing them in a room with others who are struggling, I think is important, because what you want to avoid is, the lady we go to church with saying, "Oh, you just need to do what I did. It was a breeze." And then they think that that's normalized. And that's the danger of that. But if you surround yourself with knowledge and empowerment, we end up finding in many of these classes that, this could be normal if I experience these things. And if we think something is normal and follows an algorithm, then we find the solution to it, which we're going to talk about some options that you have here in just a moment.
So can I just say,
please.
say a word about centering pregnancy?
Please.
I am such a huge fan. So centering pregnancy brings together about 8 to 10 women who have the similar due date. And they have group prenatal care.
Absolutely.
And so it's awesome because they have an hour and a half or 2 hours with their provider, and the provider is there talking to them, educating them. So instead of an obstetrician or a nurse practitioner seeing, 10 patients in an hour, they get to spend an hour and a half with 10 patients.
Right.
Everybody loves these programs. The moms love it. The providers love it. So I'm thrilled to hear that this is offered at your hospital.
And I think back to your point, the challenge is, just to be honest, Adrienne, is the fact that we don't get reimbursed for that. And so, the reality is it's got to be a commitment of the hospitals to say, we value the importance of social determinants of health. We value the relationship of gathering a group together in a room that can share similar experiences. And I think through that, we've been able to empower this new generation of moms really with the ability to say, you know what, we can seek out help. There are others sitting in the chair next to me going through the exact same thing I'm going through today. And they build bonds. We have seen this up through delivery. And they will, they become friends. They're going to each other's, parties. And so it's really, really great to see.
Awesome.
It really
is. It's fabulous. It's really fabulous. Yeah.
And so I'm going to ask you, this is kind of like a softball question, but one that we have to, ask the overall question is, why is it so important for moms to receive mental health care during and after pregnancy? If you could just kind of elaborate a little bit on that.
Sure. So it's a great question. And it's like, wouldn't we all want to receive help if we needed it, right? But mental health during and following pregnancy is really, really important because it impacts 2 people. It impacts the mom and it impacts the baby, right? So even in utero, if a mom is anxious or stressed, if she's experienced trauma, if she's being impacted by the social determinants of health, those stress hormones can actually cross the placenta and impact the baby in utero, right? And so then we also know that if moms are stressed or anxious, they may not be getting the health care that they need. They may not have, the ability to schedule those appointments, get to those appointments. Transportation is an issue. Childcare is an issue. All of those things. And so mom may not be getting the health care that she needs as a result of her mental health conditions. And so we know that children who are born to moms who are anxious or depressed may be born early. They may be small for gestational size. They may have increased opportunities to have to be in the NICU, the neonatal intensive care unit. And so it's important during pregnancy that mom gets the care that she needs. It's also really important in the postpartum period when mom is home with the baby, right? Because moms who are anxious or depressed may not interact with their baby as much as if they were not experiencing those symptoms.
Right.
They may not be caring for themselves. We know that, as I said earlier, husbands, spouses can also experience postpartum depression. In fact, the number one predictor of paternal depression is maternal depression.
Yeah.
And we also know that parents who are anxious or depressed are less likely to adhere to general safety guidelines for things like safe infant sleep, for car seat usage, for all of these things. And we know that untreated mental health conditions in the home can lead to adverse childhood experiences.
Yes, it can.
So setting up those children in the home for a long sequelae of various cognitive, emotional, social challenges.
Yeah, I don't want to belabor this any longer, but wow, you hit the nail on the head. The impact of not getting the help that's needed, the impact of that on the rearing of that child. How many times have we witnessed individuals who are really struggling, who can't comprehend the safety aspect of restraint for their child in a car seat? And so they're traveling down the road or where we're placing the child for sleep, that upon their return from the hospital, depressed, they just want to lay down in bed. And so the child goes and lays down with them. You hit it right on the nail on the head with this one. I think this is so important that once we get these individuals the proper care that they need, they integrate very beautifully back into society and can beautifully take care of their children. And that is this is the call today to our listeners, that there is help available and the programs that are available. So let's stop there and talk about that, because I know that your organization and you specifically are working on solutions and opportunities on impacting and improving maternal health. How are you doing it? What programs exist? What services are available?
Great. Well, thanks so much for asking that question. So first, I just want to underscore that maternal mental health conditions are the only truly preventable, temporary, and treatable mental health conditions.
Great point.
And in fact, mental health providers who work in this field find it so satisfying because all of their patients get well. We know what it takes to get these moms well again. And I can talk about that in a second, but
sure.
I'll address the programs and services. So number one, we have a national maternal mental health hotline. This is a 24/7 hotline. It's funded by the federal government. The number is 1-833-TLC-MAMA. And it provides both phone and text support to moms in English and Spanish and many other languages with interpreters or translators.
Yeah.
And this is one of the first programs that I advocated for when I came to this position, because I remember being up in the middle of the night with my son when he was an infant and he would not take a bottle. So I was the only one who was up feeding him. And it was January, it was cold and it was dark. And I felt like I was the only person awake or alive in the whole world. And I was worried that I wasn't going to make it through to the morning.
Yeah.
And so when I came to the shop, I was like, we need a hotline. We need a number that moms
That's amazing.
can call anytime, day or night, and talk to somebody who can hold their hand and get them through those really dark hours.
That's amazing.
Yeah.
That is awesome. That's incredible. So we're going to make sure in our show notes that we post this number, because that is so critically important to say, here's a resource 24/7.
Yeah. Another great resource for moms and families is an organization called Postpartum Support International, and their website is postpartum.net. And we refer to them as PSI for shorthand. So PSI does many things, but two things in particular. Number one, they provide direct support to moms. This was actually how I got started, volunteering for PSI, 20 years ago. Yeah, I was one of their Virginia volunteers, and I would respond to phone calls or emails from moms looking for help in Virginia. So PSI has volunteers in all 50 states. They have chapters. They have about 30 free online support groups for moms, for dads, for people with special circumstances, like maybe a baby in the NICU or maybe rural moms, military moms, all kinds of unique support groups. And all of those services to parents are free. The other key thing that PSI does is they train providers to treat maternal mental health conditions. So they have all kinds of online classes. They have a 1-hour course. They have a 2-day course. They do in person, but they are really the folks who train other people to help treat those moms. And so those are two great resources.
Two great resources that are available online. Education programs. What would you recommend for the mom listening today that says, okay, I really don't need to call the number or go to the website. What other resources are available for me as a mom? Can you think of community-based resources that go even beyond your organization that you would recommend for moms?
Absolutely. There's some great national resources that are basically mom focused. A couple of community groups that come to mind are Moms Rising and Chamber of Mothers. Those are two organizations that have a national reach. They have, again, folks in most states. They have local chapters. And we all often partner with them to raise awareness on a national level. Yeah.
And, talk to the mom directly, if you would, right now for me. Talk to the mom who's really just challenged, dealing with some of the most difficult times, post-delivery. They're at home like you were. There's hope, isn't there?
Yeah, absolutely. So what I always said, and I ran support groups for many, many years, and I talked to hundreds of moms on the phone or via email. And I said, the very first thing I would say is, I am so sorry that you're going through this, but please know that you are not alone. I went through this. I talk to moms all the time who go through this, and we are going to get you connected with help, and you are going to get well again.
Absolutely.
And PSI has a little tagline that we all say, you are not alone, you are not to blame, and with help, you will be well.
That's powerful. That's powerful. Now I want you to talk to the dads and the families that they are also important on this journey. Is that correct?
Absolutely. As both taking care of the mom and as well as looking out for the dad or the other parent as well. And I want to point out, even adoptive parents can experience mental health challenges, because let's just be very frank and honest. It is difficult to have a new baby in the household.
Yeah. As
much as we love that new baby, that baby is very, very needy and did not come with operating instructions.
Yeah, right.
And
right.
I remember, reading, babies sleep for 16 hours a day or whatever. Yeah, 16 hours a day if you're holding or rocking them or they're on your chest. I mean, some babies are wonderful and they sleep by themselves, but lots of babies need to be loved and hugged and held. And so moms who may be home on maternity leave think, my baby's going to sleep 16 hours a day. I'm going to wallpaper the bathroom and organize the photos from the last 10 years and do all these things, when really you are keeping another human being alive.
Exactly.
And, all of these moms would say, I didn't get anything done today. I didn't write the thank you notes. I didn't do all of these things. I'm like, hang on, time out. You have to change perspective here. Now we need to think about all of the things that you did today. How many times did you hold your baby? How many times did you feed the baby, burp the baby, change the baby's diaper, change the baby's clothes, change your own clothes, right? You have to have this completely different change in perspective. And recognizing that holding and loving and keeping a baby alive is challenging and exhausting. And it can be wonderful and it can be very, very draining. Mm-hmm. And so just recognizing that, like I said, having a new baby in the household is challenging. Nobody's getting enough sleep, right? Nobody's eating like they used to. The house is a mess, all of those things. And recognize that it's temporary. And that, again, just trying to shift that focus to what is important, which is keeping that baby alive.
That's right. That's right. Powerful. Adrienne, it's hard to believe our time has come upon us. And we could talk for probably another hour about, the work that you're doing. And I'm going to say, here in rural health, we do God's work every day. We're out, dealing with issues that our friends in urban areas could never dream of, individuals that come into our facility every day that lack resources, the ability to find resources, even in transportation, to get places. is a challenge. And then notwithstanding the fact that in many remote areas of our communities, there's not even still internet access. And so resources are scarce and opportunities are very limited. But to know that there's a national resource available like this is powerful. So thank you for doing an amazing work that you're doing. I'm going to encourage you to keep it up for all the many bright and right reasons that you're doing it, from personal experience of knowing what that feels like at that time. The impact that you've had in your organization, I'm going to tell you right now, I can already tell has saved lives. And that is so important. That is what we're after at the end of the day. And so if you're listening today and you're a mom who's struggling or challenging, look at the show notes. There's opportunities for you to access resources, plenty of opportunities. And you're hearing directly from someone who experienced this herself years ago in the challenges, a very strong woman, someone who was, for crying out loud, at the Pentagon. Not all of us get there, and yet still found herself in the middle of one of the most challenging storms and needed resources. So we encourage you to listen up, to look out and know that there's resources outside your window and individuals able to help you. And it's just so great to have you in the studio today, Adrienne. It's great to have you and your foundation and for the recommendations that you have provided us so far for the moms. And speaking of recommendations, this is a new closing segment because we also have a lot of leadership that listens to our podcast. And for every guest that we have on our program, we ask them to contribute a recommendation on rural life and healthcare. Now, it can be a tip for someone who is new to working in rural health, or maybe some advice on thriving in a rural setting, or just being a leader, making a difference in your community. If you could give one piece of advice today to that person listening, now we're stepping outside of the mom realm, and we're talking about rural leadership and healthcare, maybe even reaching across and finding partners like yourself. What recommendation would you give to someone listening today that's a leader?
Oh, that's a really great question. Wow. I'm going to stick with focusing on the moms. I would just suggest that everybody check in on new moms. Just ask them how they're doing and say, hey, I know this can be really wonderful. It also can be kind of a challenge, and that's okay. And there's help available.
Perfectly said. And thank you so much again, Adrienne, for your participation today and for sharing these available resources, which are life-changing and life-saving. Thanks for joining us today. We appreciate it.
Thanks for having me. It's been a delight to be here.
Thank you so much. And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you've subscribed to the show so that you never miss an episode. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.